Ever wondered how every breath you take keeps you alive and kicking? Well, that's the magic of the respiratory system, the unsung hero of our bodies. It's a life-sustaining mechanism working tirelessly to keep us active and vibrant. The primary role of the respiratory system is akin to a postman, albeit a microscopic one. It delivers oxygen to our blood, which then acts as a courier service, delivering this vital element to every nook and corner of our body. From the tip of your toes to the top of your head, every part of you relies on this delivery system to function properly. This intricate and fascinating system is about much more than just inhaling and exhaling. It's about a complex process of intake, transport, and exchange, all happening in a blink of an eye and a beat of a heart. So remember, every breath you take, every move you make, your respiratory system is working behind the scenes, making it all possible. Now that we know how essential our respiratory system is, let's dive deeper into its various components. Think of the respiratory system as a bustling city, each part playing a specific role in keeping the city alive and functioning. First, we have the airways. Picture them as the city's transportation system. The nose and the mouth are the city gates, the first point of entry for the air we breathe. The pharynx, or throat, and the larynx, or voice box, serve as the main highways, transporting air from the mouth and nose down to the lungs. Next, we reach the lungs, the city's factories. These twin factories have one primary job: converting the oxygen we breathe in into life-sustaining energy while expelling waste products like carbon dioxide out of our bodies. Inside the lungs, we have the bronchi, bronchioles, and alveoli. The bronchi are like large pipes carrying air from the trachea into each lung. These pipes branch out into smaller tubes known as bronchioles, akin to narrow streets crisscrossing the city. At the end of these streets are the alveoli, tiny air sacs where the magic happens. They are the city's workshops, where oxygen is absorbed into the bloodstream and carbon dioxide is removed. Lastly, we have the muscles of respiration, the city's workforce. The diaphragm and intercostal muscles tirelessly work to expand and contract the lungs. The diaphragm, a dome-shaped muscle at the base of the lungs, acts as the primary muscle of respiration. It contracts to create a vacuum that pulls air into the lungs. The intercostal muscles, located between the ribs, assist the diaphragm in this process. Each part of the respiratory system, from the airways to the lungs to the muscles of respiration, plays a crucial role. They function together like a well-oiled machine to ensure your body gets the oxygen it needs to thrive. They work in harmony, day in and day out, without any conscious effort from us, illustrating the true marvel of the human body. Breathing seems so simple, right? But it's actually a complex process involving several steps. Let's dive into it. Breathing as we know it is made up of two main actions: inhalation, or taking in air, and exhalation, or letting air out. But what happens when we inhale or exhale? Picture this. When we inhale, our diaphragm, a dome-shaped muscle at the base of our lungs, contracts and moves downward. This movement increases the space in our chest cavity, and our lungs inflate to fill this space. Our intercostal muscles found between the ribs also play a role here. They contract, causing our rib cage to expand, which further increases the space for our lungs to inflate. As our lungs inflate, they draw in air through our nose or mouth, down the windpipe, and into our bronchial tubes, and finally into the millions of tiny, thin-walled sacs called alveoli. This is where the magic happens, as oxygen from the air we breathe in is absorbed into our bloodstream. Now onto exhalation. This is pretty much the reverse of inhalation. The diaphragm and intercostal muscles relax, causing our chest cavity to decrease in size. This forces the air in our lungs out of our body, and along with it, carbon dioxide, a waste product that our body needs to get rid of. But who's the puppet master behind this intricate ballet of muscles and air? It's our brain, specifically a part of the brain known as the medulla oblongata. It sends signals to the muscles involved in breathing, telling them when to contract or relax, based on the levels of oxygen and carbon dioxide in our blood. So there you have it, the process of breathing in a nutshell. It's not just about inhaling and exhaling, it's a finely tuned balance of muscle movement, gas exchange, and brain signals. The next time you take a deep breath, remember the intricate process that just occurred. As a nursing student, understanding the respiratory system is crucial. It's not just about passing exams, but about saving lives. Let's dive right in. The respiratory system is a gold mine in nursing exams. You'll find questions about it sprinkled all over, from physiology to pathology. Familiarity with common respiratory disorders is essential. For instance, asthma, a chronic condition causing inflamed and narrowed airways, or pneumonia, an infection that inflames the air sacs in one or both lungs. And let's not forget COPD, or chronic obstructive pulmonary disease, a progressive lung disease that makes it hard to breathe. Why is this important? Because as nurses, we're on the front line. We're the ones monitoring vital signs, administering medication, and providing vital care. Understanding the respiratory system allows us to spot potential issues, respond swiftly, and ultimately save lives. Mastering the respiratory system not only helps you ace your exams, but it also equips you to provide the best care for your patients. So, we've delved into the wonders of the respiratory system and its importance in nursing. We've ventured through the labyrinth of the respiratory system, from the nasal cavity to the alveoli. We've taken a deep breath to understand the intricate process of breathing, appreciating the beautiful symphony that our bodies perform every second just to keep us alive. We've also seen how this knowledge is not just a fascinating exploration, but a vital tool for nursing exams. Knowing how the respiratory system works can be the difference between a correct diagnosis and a missed one. It can be the difference between a patient's relief and their discomfort. The knowledge you've gained today is not merely academic, it's practical, it's life-saving, and it's absolutely essential. So keep breathing, keep learning, and remember, your respiratory system is more than just a breath of fresh air. It's the rhythm of life.